we are going to discuss the topic Cememntum. So the subheading for the topic, types of Cememntum. So before we will go back to just have a look on the definition of Cememntum and the types of Cememntum today. So what is Cememntum? So by definition, Cememntum is a hard connective tissue that covers the root of the tooth to furnish a medium into which the principal fibers of the periodontal ligament are terminally inserted. So as per definition, Cememntum is a hard connective tissue. So we all know that Cememntum is the hard connective tissue which covers the roof of the tooth. So the crown is covered by the enamel. So instead of enamel, on the root, just above the dentine, the roots are covered by the hard connective tissue called Cememntum. So what is this primary function? So it acts as a medium into which the principal fibers of the terminal ligaments are terminally inserted. So that is the ends of the principal fibers of the periodontal ligament are inserted into the Cememntum. So the fibers cannot be inserted into the pulp or the dentine. So the Cememntum will act as the medium into which the fibers are inserted. So the other terminal insertion occurs into the alveolar bone. So on the fibers are inserted in one side into the bone and on the other side into the tooth on the medium called Cememntum. So that is the main function of the Cememntum. And we have studied that the fibers which are terminally inserted both into the Cememntum and the periodontal ligament are specifically known as Sharpie's fibers. So once again, Cememntum is the hard connective tissue that covers the root of the tooth to furnish a medium into which the principal fibers of the periodontal ligament are terminally inserted. So that is how the Cememntum is defined. So now Cememntum is a calcified avascular mesenchymal tissue that forms the outer covering of the anatomical root. So in simple terms, it is nothing but the covering of the anatomical tooth, which is calcified as well as avascular in nature. So the Cememntum was first demonstrated in 1835 jointly by Franke and Raschkow. So what is the location of the Cememntum? So the Cememntum begins at the cervical portion of the teeth at the cemento-enamel junction and continues towards the apex. So from the apex till the portion called cemento-enamel junction. So that is the junction which occurs at the cervical portion where the Cememntum and the enamel meet. So enamel covers the crown of the root, whereas the Cememntum is the outer covering which covers the root of the tooth. So the extent is from the cervical area to the apex. So broadly, the Cememntum can be classified into acellular Cememntum and the cellular Cememntum. So the acellular Cememntum is otherwise called primary Cememntum, whereas the secondary Cememntum is also called as cellular Cememntum. So in today's class, we will discuss in detail about the types of Cememntum, how they occur, so why are they called so. So I am Dr. Sunjith Sudhakar, and today we will be discussing in detail the topic types of Cememntum. So the Cememntum can be broadly classified into two, that is cellular Cememntum and acellular Cememntum. So the acellular Cememntum is otherwise called primary Cememntum, whereas the cellular Cememntum is otherwise also known as the secondary Cememntum. So we will look into detail. So based on different criteria, Cememntum can be differentiated into different types or rather classify Cememntum. So what are the criteria? They can be divided on basis of formation. So at what period the Cememntum is formed. Then based on cells, whether there is presence or absence of cell. Then based on fibers. So according to what type of fibers or the fibers present. So fibroblasts or any kind of cells produce fibers. So on the basis of the fibers also, the cementum can be classified. So then based on type of fibers. So according to what type of fibers, so they are classified. So based on formation, so which is the main classification. The most important one is based on formation. So based on formation, cementum is classified as either primary cementum and secondary cementum. So on the basis of cells, so by the presence or absence of cell, cementum is classified into broadly as acellular cementum or cellular cementum. So from the name itself, we will identify acellular means there is no cells. So if any cementum which is devoid of any cells is called as acellular cementum, whereas cementum containing cells are known as the cellular cementum. Then based on fibers, so based on the presence or absence of fiber. So any cementum which has presence of fibers in it are called fibrillar cementum, and the cementum which is devoid of fibers or absent of fibers are known as afibrillar cementum. Now the fourth one, based on the type of fiber. So if the fibers are present, again we subclassify it as according to the type of fibers present. So they can again be subclassified as intrinsic fiber cementum, extrinsic fiber cementum, and mixed fiber cementum. So from the frame, intrinsic means intrinsically or internally formed cementum. So any cementum which has cells which produce its own or fibers synthesized or secreted internally. So those kind of cementums are called internal fiber cementum. So if the cementum contains any kind of fiber but formed externally and inserted into it, so that is the fibers present which was formed externally, then that kind of is known as the extrinsic fiber cementum. Then you also have the mixed fiber cementum, where the cementum consists of fibers which are a mixed group of intrinsic and extrinsic fibers. So if both intrinsic and extrinsic fibers present, it is subclassified as mixed fiber cementum. So we can classify it on based on formation to primary and secondary, based on cells as acellular and cellular cementum, and based on fibers are fibrillar or afibrillar cementum, and based on type of fibers are intrinsic fiber cementum, extrinsic fiber cementum, and the mixed fiber cementum. So acellular means their cells are not present. So the primary cell present in cementum is known as cementoblast cells. So there are cementoblasts are the cells which are secretory to the. So sometimes these cells can get embedded into the tissue. So any cementum which does not contain the cells are known as acellular cementum. So it is the first kind of cementum. So it has fibers, but it is devoid of any cells. So the fibers are the fibers inserted from the periodontal fibers. So the fibers are known as Sharpie's fibers. So they are formed during the root formation. So during the root formation, before the tooth reaches the occlusal plane. So before the tooth reaches occlusal plane, there is no any masticatory stress. The tooth is devoid of any masticatory stress. So, but the primary function of the cementum is to fix the tooth into bone. So it is the cementum will contain fibers, but it is devoid of any bone. So it covers approximately 1/3 of the root. It does not contain any cells. It is more calcified, and the formation is very slow because the tooth has more time since its formation till eruption until the root formation is complete till the tooth reaches occlusal plane. It is a slow formation state. So the arrangement is of the collagen fiber is more organized. Moving on to cellular cementum. So this is the cementum which is formed after eruption of the tooth once it reaches occlusal. So now the cementum also has it formed according to the response to functional demands. What is the functional demand? During mastication, forces are directed towards the tooth. So all the forces directed due to the masticatory process directed on the tooth, it transferred to the dentine from the cervical area till the apex. So these forces has to be transmitted and distributed by the dentine, causing functional demands. So since this is formed after the tooth is firmly formed, so the Sharpie's fibers occupy only a small portion. But the cementum, due to the rapid formation of the cementum due to the functional demands, cementoblast, which help in formation of the cementum. So they secrete cementum on all sides, and ultimately the cementoblast gets entrapped within the cementum. So thus the cementoblast which gets entrapped within this cellular cementum are termed cementocytes. So just like osteocytes within the bone. So cementocytes are nothing but cementoblasts which are embedded within the cellular cementum. So since the cementum is an avascular tissue, these cells require nutrition. So these communicate with each other through the presence of the canaliculi. So they communicate each other through the canaliculi, and they are embedded within small areas within the cementum known as the lacunae. So cellular cementum covers apical two-thirds of the root. They contain cementocytes. The deposition is more rapid due to the functional demands of the tooth, as the tooth is being formed with lot of masticatory forces directed towards it. So now the collagen fibers are irregularly arranged. So whereas in a cellular cementum, the collagen fibers were regularly arranged and it was formed by slow deposition. In cellular cementum, the deposition of cementum is very rapid, causing the collagen fibers to be irregularly arranged. So thus, based on cellular connotation, so there can be cellular cementum and acellular cementum. So now, based on the fibers. So based on the fibers, we can subclassify it as intrinsic fiber cementum and extrinsic fiber cementum. So the fibers in intrinsic fiber cementum, there are fibers which are intrinsic in nature. So the fibers are secreted from the synthetic and secretory activities of the cementoblast. So along with cementum formation, the fibers, the collagen fibers formed are synthesized and secreted by the cementoblast itself. So that is, the fibers are internally synthesized, giving the name as intrinsic fiber cementum. So the second type is extrinsic fiber cementum. So from the name itself, we can assume that the fibers are extrinsic or externally synthesized. So in this form, the extrinsic fibers originate from the principal fibers of the periodontal ligament, and they are termed the Sharpie's fibers. So these fibers are the specific Sharpie's fibers help to attach the tooth into the alveolar bone. So these fibers are produced by the principal fibers of the periodontal ligament and externally formed, giving the name extrinsic fiber cementum. Then we have the mixed fiber cementum, where the cementum is comprised of both intrinsic and extrinsic fibers. So then afibrillar cementum. So as cementum is completely formed and become fully calcified, it is seen covered by the reduced enamel epithelium. So after the tooth formation is formed, the enamel is covered by reduced enamel epithelium. But sometimes accidentally the reduced enamel epithelium can retract from the cervical region. So thus the enamel gets an interaction with the mesenchymal cells. So the mesenchymal cells come in direct contact with the enamel. So just like the formation of the root, the mesenchymal cells near the crown portion can also get a stimuli and differentiate into cementoblast and deposit a specific type of cementum on the enamel surface. So this kind of cementum, that is non-functional, without any fibers, deposited due to the interaction of the newly formed enamel with the connective tissue component, is known as afibrillar cementum. So now we studied about the types of cementum. Now Schroeder and Page classification. So Schroeder and Page in 1986 came up with the classification of the cementum, so on the basis of location, morphology, and the histological appearance. So they classified it into 5, namely acellular efibrillar cementum, acellular extrinsic fiber cementum, then cellular intrinsic fiber cementum, cellular mixed stratified cementum, and finally the intermediate cementum. So Schroeder and Page came up with, so instead of the different classified on the basis of several aspects, they regrouped them as 5. So they made it into 5 simple groups. So instead of making it into classifying on the basis of different aspects, they classified it into a single group comprising of 5 types of cementum. So acellular efibrillar cementum, acellular extrinsic fiber cementum, cellular intrinsic fiber cementum, and cellular mixed stratified cementum. So from this diagram, we are able to find that the cervical area is formed of acellular fibrillar cementum consisting of fibers but without any cells. But as it comes down, we will do that towards the apex. We are able to identify that the cells are not, it is formed after the tooth has undergone eruption. So due to the functional demand. So these consist of, these are rapidly formed. They are primarily containing more of cells and less of fibers. So with the embedded cementoblast, specifically known as cementocytes. So they are the cellular cementum. So you have the cellular intrinsic fiber cementum and the cellular mixed stratified cementum. So mixed stratified comprising of it is cellular in nature and containing both extrinsic and intrinsic fibers. So acellular efibrillar means from the name itself, they are having both fibers and cells absent. Then acellular, here the fibers are densely packed, cells are absent. It is formed by the fibroblasts and cementoblasts of the cell. So it is known as the acellular extrinsic fiber cementum. So extrinsic means it will have bundles of sharpish fibers. Then you have the cellular intrinsic fiber cementum. Here there is cellular in nature, that is cementocytes are present, and the fibers present are intrinsic in nature. Cells present are called cellular cementum. So the cells present are called, so the cementoblast gets entrapped, called cementocytes. So there will be presence of cementocytes. Then cellular mixed stratified cementum. So here it is cellular in nature, both intrinsic and extrinsic fibers are present. So they are seen more towards the apical 1/3 of the root. Then you have the intermediate cementum. That is, it is formed of the cellular remnants of the Herdwick's epithelial root sheath seen in the cemento-enamel junction formed due to interaction of the outer mesenchymal tissue with the newly formed enamel due to the early retraction of the reduced enamel epithelium. So those are the different types of cementum. So the learning objectives from this topic would be to study the definition of cementum and study both types of cementum. Otherwise, the question can be asked as classification of cementum. So on the basis of the different criteria and according to Schroeder and Page classification, so the different types of cementum has to be studied. And the assignments of the topic would be to prepare a concept map on the different types of dentine. And you have to learn as a critical pedagogy on the importance of the different types of cementum. So that would end the topic types of cementum. Thank you.